Hello, this is Dr. Tim Sandle and I'm back with you with another video looking at things relating to the coronavirus, and this is part of a ongoing series of videos that I've been making since April 2020. They've not come out lately as regularly as I like, but anyway, here I'm back, and as before, the aim of these videos is to dive into a new area of scientific research, and as always, although I'm presenting different findings, the aim is to encourage you to read up for yourself. Don't take my word for anything, and have a look at the scientific papers that are designed to support the different facts that I'm presenting. So for this video, I'd like to look at some new research that is looking at coronavirus spread, and this comes from researchers working at Simon Fraser University, and they've examined coronavirus transmission and looking at the most effective ways for reducing the SARS-CoV-2 viral transmission during this current period. And the research places considerable emphasis upon physical distancing, or what is sometimes called social distancing. And this seems to be far more effective in the general sense than other factors like social bubbles or the wearing of face masks. Now, these other two measures are very important, forming social bubbles and wearing face masks, but they're far more situation dependent when the effectiveness of these actions is measured. Now, the focus of this new research is on indoor venues, and we know that the transmission of the virus can occur via airborne droplets, and it's likely that outdoor transmission risks are lower. Now, the scientists have also determined that the protection from transmission increases with physical distancing in a kind of a linear proportion, so that's each set distance away, the lower the transmission becomes. And as to how this conclusion was reached, the Simon Fraser scientists conducted a model designed to explore the relative effectiveness of the main measures being recommended by many governments and their scientific advisory boards. So to develop the model, the researchers came up with their own concept, which they've called Event R. So it's kind of in keeping with the R number, but this is called Event R. And by this, Event R represents the expected number of people who become infected with the beta coronavirus and develop COVID-19 symptoms stemming from just one infected individual present in a given situation. And for the model to be robust, a series of variables needed to be considered, and these variables were transmission intensity, duration of exposure, the proximity of individuals, and the degree of mixing of those individuals. And this includes events classed as high density and or low ventilation settings. So within the context established, the next step was to consider the different recommended preventative actions. So these are the measures recommended by governments and advisory boards, and to see which ones were most effective in preventing viral transmission under different sets of circumstances. So to achieve this, as might be expected, voluminous amounts of data were inputted, and this was using data extracted from reports of outbreaks at different indoor events, so it included things like parties, people coming together for meals in restaurants, nightclubs, going on public transit, and in other areas where people are kind of mixing in social settings. Now, the most significant factor determining a given individual's chances of becoming infected and going on to develop COVID-19 was found to be duration. That is the amount of time each individual spends in a given situation in a practical setting. The different events were subsequently classed as either what the researchers called saturating, which means a high transmission probability, or linear, which indicates a low transmission possibility. Situations that fell under the saturation or high transmission category were bars, nightclubs, and overcrowded workplaces. Another type of setting associated with large numbers of eventual cases were religious venues, attending churches and other places of worship. The common features of these meetings were large numbers of attendees in confined spaces with the possibility of engaging in physical contact. In contrast, the low transmission category included public transport with masks, appropriate distancing whilst consuming meals in restaurants, and outdoor activities. And with the different preventative measures that can be taken, the findings indicated that physical distancing was by far the most effective measure that can be taken for reducing viral transmission in each of the settings. With the other measures, the effectiveness of social bubbles was found to be heavily dependent upon whether the chances of transmission were high or low. So that means that social bubbles were more effective in the linear situation than in the saturation situation. So that means that social bubbles were less effective than, say, congregating in a bar compared to coming together in a workplace. The important risk determinants were number of people, the amount of mixing, the levels of crowding, the noise level, because we know that the louder someone talks or engaging in singing, for example, then the higher the chance of coronavirus transmission, and then the duration of the event. And even in the kind of lower risk areas like workplaces, especially where numbers of people is reasonably high, then the most important factors were using the same work area and ensuring that workplace social bubbles existed. So when people come to work, they're mixing with the same people, not mixing with different groups, and keeping numbers in an enclosed environment quite low. So hot desking, for example, is something that might result in a higher chance of coronavirus transmission than, say, sitting in a fixed space close by to people, the same people on a regular basis. With masks, there was naturally some effect, but the effectiveness is reduced in highly populated, high transmission settings. So, for example, at parties, particularly house parties, choirs, restaurant kitchens, crowded offices, nightclubs and bars, then, although wearing a mask helps, the more people and the longer the time, then the lower that effect became. Because this happens because even though masks have been shown to halve transmission rates, they do not alter the probability significantly, as this effect is counteracted by the high numbers of people and the prolonged time and association with people. And of course, you still need to wear a mask when required. Wearing face masks protects yourself and others. It's all about, these measures decreasing if time goes on and numbers increase. And this is all part of the continuing development of information in relation to the coronavirus. and our body of knowledge continues to grow and to expand. But there still remains a lot to learn about the epidemiological aspects. So, if you want to read about this study further, then it's published in the Proceedings of the National Academy of Sciences, PNAS, and the paper is titled Event-Specific Interventions to Minimise COVID-19 Transmission. Okay, so this brings this video to an end. If you found this video of interest and you want to be kept up to date with new content, then please subscribe to my YouTube channel and you'll receive the latest videos on coronavirus and other science-based subjects that I'll be posting on. So, I'm Dr. Tim Sandle. Hope this video has been of some interest. And in the meantime, please stay safe. Goodbye.